welcome to another episode of Step by Step Talks. I'm Rohini Kapoor, your host, and today we have a very special guest, a very, very smart guest, and a woman who's got, determination. She's professional, and I think she's one of the most dedicated persons I've ever met to her career. Dr. Karishma Daryanani, welcome.
Thank you. Thank you for having me.
You're very welcome. It took me a while to get you, but I'm so glad we did, right? Now, I want to introduce Dr. Karishma Daryanani as a person who dedicated her education to becoming a dermatologist, and then just recently was also in Spain doing a specialization in cancer treatment.
Yes, my subspecialty is in cancer.
Cancer, right. So before we proceed, Karishma, is it okay if I call you Karishma?
Oh, of course.
Okay,
please.
thank you. I want you to talk to my audience because Step by Step Talks promotes women being financially independent. And I see you as a professional, independent woman who worked very hard to get where she is today. And I think that you would be a role model to a lot of women out there, no matter what juncture they are in their lives, whether they are just single, whether they are divorced, whether they are starting out new. I always call it an experience. For me, nothing is a failure. Everything is an experience. So would you like to give us a little bit on how you think and why it's important that women should be financially independent, and maybe a point on how they should get there?
Okay, what an excellent question. Well, I always promote financial independence for both women and men. Everyone should just be independent. The main reasons why: control over your own life, where you can make your own decisions, where you make decisions that are in your best interest. Having said that, also it allows you to pursue what you really enjoy to do. It gives you a focus. You're working towards not just the financial independence. With focusing towards a goal, you also gain financial independence. Of course, you can plan for unforeseen events, and we can never predict that. No matter how much we plan in our youth, we don't know what life is going to bring. And so it's always nice to know that we have a little bit of financial security.
Exactly.
And in our own financial security, where we're not depending or hoping someone else will do it for us. And then kind of coming back to the pursuing your own passions, you build something that's yours. And with that comes also self-confidence. And yeah, basically it. That's why I think all people, women especially, should be in complete financial control of their life.
Perfect. Thank you. My last guest that I had said, education was a very important part. And I totally agree that part of, getting financially independent is having a little bit of education about anything, really. Now, I want to go back to when I first came to see you as a patient. That was a year ago. And you were doing, you were doing great. You had your clinic and you suddenly decided out of the blue you wanted to expand. So what is all this expansion about?
Okay, so I've always, up until now, been very serious and focused more on the cancer part and on the clinical dermatology, which is the serious stuff. The rare disorders that you see in children, the rare disorders that adults develop. But over time, and due to demand from my patients, I have decided to offer a wider variety of treatments. And so that's the expansion. The expansion is an advanced skin therapy subclinic, if we'd like to put it that way, where I'm offering hair removal, hydrodermabrasion, and just kind of complementary treatments to my more serious practice.
Yeah, perfect. And you know what? I was just reading that I think every student spends about $2,000 a year on skincare and seeing dermatologists. Did you know that?
I did not know
University students are spending about $2,000 a year, which is a lot of money for that.
That's a lot of money.
Mere seeing a dermatologist, right?
Yeah.
And now, in this climate here in Panama, you must be getting a lot of people with a lot of skin problems.
Yes, we do.
So I think it's important for our audience to understand what you see and what we should do to avoid.
Well, the basics. We go back to the basics. In terms of what we can do on a yearly basis, attend your dermatology full body checks and make sure everything is in order. But in terms of how to avoid skin problems, use sunblock, don't expose yourself directly to the sun, be careful. And you mentioned a very important point. If college students are spending $2,000 on dermatology appointments, for what? Are you overdoing it? Are you doing procedures that you don't really need? This is also very important. Yeah. You really, at that age, most patients that don't have an underlying condition really just need to be using sunblock. You don't really need to be doing all of these very important procedures that are meant for older patients. And that I am seeing, that I do see patients, very young patients that come in for certain procedures, and we halt and we say, no, this is not for you. Okay, for you, you want to look like this in 20 years, you just keep on going, keep on doing what you're doing, and just use your sunblock.
And just use your sunblock.
Yes, that's
all.
So
I think that's what you told me the first time as well. You don't need any expensive lotions, you don't need any expensive creams, just use sunblock and some very good moisturizer. I think that's what you had said, right?
Yeah.
Now, when as you've progressed in your career, what are you seeing that is too prevalent, is very prevalent due to environmental changes? Because I think my audience would like to know that. Because a lot is talked about environment and what the environmental changes are doing to you, internally. But what about your skin externally?
Well, I'm seeing a lot of atopic dermatitis and in older patients. So in training, it was more of a condition that we saw associated with children. In the clinical practice, I'm seeing a lot of atopic dermatitis, that's colloquially skin allergies. I'm seeing that in adults, and I'm seeing that in older adults. So we have a large expat community in Panama. They come from one climate to this climate, and they're suffering. And then the recommendations, everyone initially likes to be, Dr. Google and check everything on Google, course, yeah. And then invent and put these sometimes herbs, natural essences on their body, and they complicate matters worse. Okay? And with the humidity in Panama, we're seeing a lot of these rashes. So that's something that I didn't expect. This is a trend that I find a little bit odd.
And do you see that? Have you talked to other doctors who see the same thing?
Yes. All of our colleagues are seeing the same thing, and we attribute it to the change of environment and also to this new movement, this post-COVID anti-doctor movement where everyone wants to use stuff like beef tallow on their skin, and that's not where it is. Things are a lot more basic than that. This trying to avoid chemicals and trying to keep things natural are actually causing more issues than solving them.
Oh, is that right? So
yes, absolutely.
Okay, yeah, because that's true. The herbal industry has really progressed and grown huge because they're trying to avoid everybody to stop using chemicals. So these chemicals that you're talking about, they are safe to use and they should be used when you have a problem?
Yes, absolutely. Well, everything's a chemical, okay, fundamentally. So it's really marketing and branding.
Yeah.
And really fundamentally, if you see the owners of these companies are the pharmaceutical companies. They own the wellness industry. Right. It's just two branches of the same thing. At the end, it's just a lot of pushing, confusing, and marketing.
That's very interesting because a lot, like I said earlier on, I have seen in the past that even in North America, there are a lot of people are turning towards the natural side of things.
Yeah.
Right? And then they only come to you at the end.
Yeah,
when it's too hard for you.
When it's already, a little bit, well, not too late, but when it's really become quite aggravated. And then you're treating like two or three things, one on top of the other, because treating the fundamental problem and then the burn on top of that problem, then the infection on top of that. And it's like, okay, now we have to separate everything because you took this a bit too far. And all you had to do was kind of trust your provider. I mean, no one really is here to damage patient's skin. We're all here to take care of our patients.
Of course.
But there is a major distrust in the industry, not just skincare, in medical care in general. And I think that is compromising a lot of our patients.
So that leads me to my next question. And that is that, there are so many treatments out there right now. There's laser this, laser that, do this, do that. What is right and what's wrong? What do women do? Because some women get addicted to it and are going for everything.
Right.
So what do we do and what don't you do? Like how many lasers are there out there? Which is the good one?
There are many.
Yeah.
And what a great question.
Yeah.
And so then I like to tell my patients that come in and tell me like, what do I need? And I'm like, okay, well, let's fundamentally figure out what do you want to improve? Because not all the treatments are for everything. And then we like to brand, or the companies like to brand their products and their services as anti-aging, but that's such a broad term. We have to break it down. Is it structural? Is it textural? Is it pigmentation? And then there is a treatment devoted to each one of these issues. So fundamentally, we need diagnoses. We know what's going on, okay? And then we can recommend which laser for what. Okay, are there a vast majority of lasers for like skin tightening? Absolutely, yes. Do they all have their pros and their cons? That all of that can be discussed, but they're all basically the same. Okay, all the tightening ones are basically achieving similar results. But then we come into the medical part, and the medical lasers, everything has its own target. Not all lasers. The energy that the laser emits is not absorbed by the same type of cell. Okay, this varies amongst the laser. So you first need a diagnosis. You first need to know what is wrong to know what treatment the patient needs.
Okay, so when you see, we walk into a clinic and say, okay, I want skin tightening. Oh, we've got the best laser. It's the number one in the industry right now. Mm-hmm. Technically, there are also another 20 others that are exactly the same.
The technologies,
could I say that?
The technologies are, I would say, on one hand, okay, maybe like 5 different types of technologies, then the brands vary. And now it's just a question of which brand you're talking about. Okay. But the fundamental technology, there are only a handful. Radio frequency and microneedling, there's high intensity ultrasound, like a high intensity focused ultrasound. It's also very popular. And then there's actual laser, which is making kind of invisible holes in your cell, trying to tighten your skin. And in an ideal world, the patient would do them all to gain the maximum benefits, but no one really is going to do that, because what are you going to be stuck in the dermatology office every week, attempting to tighten your skin?
That's right. So what do you suggest? Let's say if there's a young lady who comes in and says, okay, I want to maintain my youth and I want to look good. What are the 5 points you will give that this is what you should do?
Okay.
What is the first, from 1 to 5 or 1 to 10, however you think is the correct way to go? Because instead of going here and trying stem cells and going here and trying skin tightening and then doing microdermabrasion, what would you suggest? Give us 5 points or 10 points.
Question.
Right?
Okay, so actually my answer varies according to age range. So if it's a patient in her 20s and hasn't, maybe 20s, early 30s, I would say just focus on your sunblock. And then maybe you can do some preventative treatments with a bit of like a photofacial, that's intense pulse light, or maybe even, depending on the quality of that patient's skin, maybe even a little bit of like a clear lift, a Q switch. If it's a patient in her 30s to early 40s with mild signs of aging, we could go with a bit of, that's why I don't like using the word aging. Let's be very specific.
Okay.
Let's say a bit of volume loss.
Okay.
We can restore that volume loss with fillers.
Yeah.
Okay, and I love fillers because it is a subtle way of kind of bringing your face back to, of kind of modifying that hollow. Okay. Which impacts the patient's face in a very important way. And maybe a little bit of intense pulse light, a little bit of Q switch, or if it's a patient with a lot of facial damage, we could do like an ablative laser as well, which is like, if you can imagine taking off a thin layer of the top of the patient's skin and having them, produce new healthy skin underneath.
Right.
And then if it's a patient maybe from 40 to 50, I would say fillers could be an option, but would go more heavily on more of the damaging lasers. And then a patient who's a little bit above that has important sagging, I like to refer them to the surgeons.
Oh, yeah. As a facelift?
Yes, because of the expectations. Now,
okay.
I don't like to say that we are going to revert 20 years of structural loss with a couple of procedures. Like, what can we improve? We can improve the skin texture, we can improve luminosity, we can maybe get rid of the under eye circles, improve a little bit marionette lines. But if you really want to see that drastic change, you're going to come in and expect such a drastic change with one procedure. That's not realistic. That's better had with the surgeon. Okay. And the way surgery is heading, I think maybe in 20 years we're all kind of headed for a facelift, because the techniques right now are they're very impressive.
And they're kind of non-invasive, right?
Yes.
Yeah, that's right.
So keeping all of that in mind and patient expectations in mind,
eventually you do end up going there.
I think we will probably all end up there.
Okay. Well, that's very interesting, because, you know, if you talk about facelifts, about 30 years ago, it was a very painful procedure, and you're in bed for a few weeks, I think, after, right?
Yeah.
That's amazing. Now, do you recommend that, you know, somebody in their 20s and 30s should go for Botox and for fillers?
Patients in their 20s should not be getting Botox. There's really no need, with the exception of a few patients that are genetically predisposed to forming lines. So I actually have treated a 19-year-old girl. She's also kind of a budding actress, and she's developed the indentations from all the muscular movement. She also has a very strong, overly active muscle. She's like an exception. Okay. Everyone else, no. Okay, you don't need it. There's no objective in your 20s. Now, in your 30s, if you're already, I mean, this also varies from provider to provider. A lot of providers will say, like, let's avoid. I personally, when my patients ask me, do you think I need it or not? My answer is based on, are you already forming the line without movement? Then we'll put some Botox in so that it doesn't get worse, and we can maybe erase the line a little bit. Okay? And basically, that it has to have like a function. Okay? Fillers, same story, just maybe at a slightly later age. And this is also dependent on the patient. So I've noticed that patients that benefit the maximum from lasers, especially under eye, are patients that have either lost a lot of weight recently, or just had a baby, and the baby has consumed their face, and they're looking tired and hollow, or athletes who also have that tired and hollow look, and just a bit of filler in the mid-cheek changes everything. And sometimes the patients don't even know what it is that's making them look old or tired, and it's just one tiny little tweak that makes all the difference.
And you specialize in that, of course.
Yes, absolutely. I was trained in London. My aesthetic training was in London.
So somebody with, you know, just wanting a little bit of a radiance or a little bit of a change because they're looking a bit tired, it's a good idea to come and see you.
Oh, yes, absolutely. But fundamentally, we need to make a diagnosis. We need to point exactly or pinpoint what exactly is the problem to be able to offer the adequate solution, because not everything is for everyone.
And that's where I think I want to ask you this question, is that a lot of people are offering Botox and fillers, but they're not trained to actually diagnose what the problem is. And this is why everybody should come and see you, because you're going to be able to diagnose this is the issue.
Yes, absolutely. It's very important to go to a trained professional and not just, you know, I was in the hair salon the other day and I overheard that in the back room they're doing like Botox and fillers. That I find that ridiculous. Not just from the point of view of, do they even know what, where, how, what level, the anatomy? Is that even the issue? So yes, everyone should go to a trained professional for an evaluation first and an explanation. And that's what I kind of offer my patients. Like, let me explain to you why you have this line here. Well, the bone here gets reabsorbed and it falls.
Right.
With time. This is a structural issue.
Okay.
No cream applied here is going to get rid of that, because literally the structure needs to be put back.
Right.
Whether it's done surgically or whether it's done with fillers as an optical illusion, because really that's what fillers are. They're just optical illusions hiding volume loss, and we're just, you know, chasing shadows and lines.
Yeah, no, that's very interesting, and I think my audience should be aware of that if you are planning to go and do some work on your face, see a proper dermatologist before you go. Let's just touch on product now, because there's so much product out there when it comes to Botox and fillers.
Yeah.
And I know I've heard some horror stories from my friends that they've used the wrong Botox or they've used the wrong filler. What are you suggesting would be the best kind of product that a dermatologist should use? And I know you use the best
Yes.
quality there is.
I think it definitely should be something with something that's brought in kind of legally into the country, and that's very important to find out. No, you'd be surprised. There's a lot of product being smuggled in. So I think it's very, very important for patients to know that they're getting their product from a legitimate provider. Besides that, in terms of Botox, everything that's kind of legally Botox, it's all basically the same.
It's the same.
Yeah.
So when you say the illegal product that's being brought in, that's not the real stuff then? It could be...
The problem is we don't know.
Oh, you don't know.
And there were reports in the US recently in Miami of products that claimed to be Botox, but it wasn't Botox, and then people don't know what they were being injected with. There was a whole issue, and there needs to be a bit of control
on the product, on what products coming in, and that's why it's good to go to a licensed dermatologist who is getting the proper products come in, obviously, right? Let's go back now, talk a little bit about cancer. You went to Spain to do your exams, and I think you topped the class, which was amazing, right? I want you to talk about that. What did you go for? What did you learn?
So I did a subspecialty over the course of the last year in cutaneous oncology, in all of its forms, and some specialized surgical techniques. So we did, and all dermatologists are experts in skin cancer. That needs to be very clear. But I went in with 4 other colleagues from Panama to do additional training. So that makes us a little bit more specialized. Okay? Additional techniques and, just basically more information, tips and tricks on how to deal with cutaneous oncology. So we've all finalized our masters last year, and
Are there developments into actually curing skin cancer now? Are there more?
Absolutely. The world, right, a lot of focus was placed on immunotherapy and genetic mutations, and I think we are soon going to be painting skin cancer in a very genetic light instead of a very descriptive light. So right now, skin cancer is described based on pathology, on what the pathologist sees, the types of cells that the pathologist sees, and the pattern in which the cells are distributed. So it's a very structural description. And the way we're heading in, and I wouldn't say just cutaneous oncology, I would say oncology in general, is that everything is going to be very mutation based. So what's mutated, and therefore how that mutation can give us prognostic factors, and how that mutation can open doors to certain treatments that can be available to that particular type of cancer.
So it has progressed a lot over the last 20 to 30 years, right?
Oh, yes.
It was like, you're not just cutting the skin out in chunks and getting it off.
No.
You're treating the actual cancer. What about stem cells? Because now you talked about mutation, so I know
it's a bit.
We've talked about that before.
That's a tricky topic, and I definitely did not want to step on anyone's toes, because I do have colleagues that I respect in the business, in the stem cell, industry, especially in Panama, but it's a bit scary. Okay, so stem cells are cells that can, in theory, become any type of cell. Right. Okay, and that sounds exciting from the point of view of I have a damaged cell, so let's get a new cell and repair it with this cell that can become anything, this pluripotent cell. However, that cell, because it's a stem cell, has that infinite capacity to divide. And by definition, that's what cancer is too. So since we're still not sure what the long-term effects are of stem cell therapy, I'm reluctant to be in favor or against. Until I see
what happens.
And I'd like to see the studies, and I think that's what we're all waiting for. We're waiting for like long-term studies, and ultimately, when there is a massive review, then we should be able to formulate a response.
So how new is stem cells? And I thought it was over 20 years.
I would say, yeah, anywhere between 15 to 20 years, but the evidence is mixed. And the side effects are also mixed.
Ah, okay. So there are side effects to stem cells treatments?
Yes.
Okay,
Yeah.
all right. Because they usually say no side effects.
Yes, that's
Everybody
why.
says no side effects.
No,
Yeah.
the thing is, when you sign your consent, you're kind of signing. You're basically saying, yeah, whatever happens, happens because I made this choice on my own.
I see.
Okay. So,
Okay.
and then the right way in science or in medicine, well, in science in general, the right way to define like rates of side effects is to take a group of people with the same condition and give them the same treatment and compare that to another group of people with the same condition that didn't get the treatment. Okay.
Yeah.
And that way we have numbers of people and we can calculate rates and percentages. Okay. Yeah. Now, and of course, adding to that, patients don't know if they're getting the treatment and if they're not getting the treatment. So that means it's blind, like
a placebo.
Exactly. Mm-hmm. Okay. So having said that, that's not really happening in stem cell therapy right now. Right now, it's an individual person with a very unique condition. Usually, it's a patient that has tried everything.
Then they come down.
Mm. And then this is kind of one of the last resorts. Right. And then are they overjoyed? Yes, they are overjoyed. I've seen it with my own eyes. I have patients that are very, very happy.
Yeah.
And usually these are for neuromuscular conditions.
Yeah.
Okay. Not for really skin. I do think it's overkill for skin.
Okay.
Conditions, but in general in medicine, for these lesions, you do see a lot of happy patients. But then, how do you fit that anecdote to it within? How do you quantify one patient's individual experience? You can't really quantify it. You know, like, is it measurable? Are all the other patients with the same condition feeling the same way? Mm. And they're not going to be able to get to do those types of studies until they report these individual cases. And I think kind of that's where we are right now. We're in that phase of stem cell treatments and therapy. And then maybe when they do these massive studies, then I'll be able to formulate a more well thought out answer.
Once you know,
once we have more information. Well, because right now it's all speculative.
Panama is the biggest place in the world for stem cells. There are lots of people who come in here, right?
Yes, and I'll be honest, a lot of patients who are very happy.
Yeah.
Yeah, like you're not really seeing a disappointed patient.
No.
You know,
no.
So that's exciting for the patients.
Now, if somebody wanted to come and see you, Karishma, where can they contact you? Where is your...
We have a website, and you can actually book yourself online without having to talk to anyone if you
don't want to.
And that's
technology.
Yeah. And well, I'm from a generation that if we don't have to contact anyone, we won't.
Yeah.
So we really like, our apps and our, like, I don't want human contact. I'd rather avoid it.
Yeah.
That's my generation. Or if you'd like, there is a WhatsApp number, and my assistant is on top of it, and she's very organized.
So your clinic is called Dr. Karishma Daryanani, or do you have a named clinic?
I mean, we also call it Candy Skin Doctor. That's, I guess, my Instagram handle more than anything.
Okay.
So, but my clinic is Dr. Karishma Daryanani
at the Panama Clinic.
Mm-hmm.
Furthermore, would you like to tell our audience how many times a year should they visit their dermatologist?
Once a year.
Definitely, whether you have a problem or no problem.
Okay, so if you're just going in for a total body check, body check is where the physician, the dermatologist, should remove all of your clothes and check every nook and cranny. Okay,
for molds and for
everything. So there are three components, three things that we look for, three things that we should look for. One, pigmented lesions. That's mole check. Two, carcinomas, that's making sure there's no sun damage that's progressed to a pre-malignant or malignant lesion.
Right.
That's category 2, because those lesions are actually not pigmented lesions. They're usually pinkish lesions. They look like pimples. Okay?
Pimples, yeah.
And usually patients will come in saying like, I have this pimple, that's not improving, it's crusting over, and that's a carcinoma. And then 3, signs of metabolic disease. So signs of diabetes, signs of thyroid conditions, signs of other cancers inside the body that are expressing themselves in the skin. And so those are the 3 things that your dermatologist will look for in the full body check. Okay, and they should check, behind the ear, under your armpits,
Yeah.
like in the nails. Patients that come in with their nail polish, and like, oh, you don't listen to, my instructions. You need to take off your nail polish. It's like, why? Skin cancer is also found on the nails. Of course, it's in Panama, it's one of the common locations under the foot. Those are acral melanomas and in the nails. So we need to revise everything. Nails also can be the window to other metabolic diseases like psoriasis. A lot of patients are like, yeah, no, I've had this fungus for like 25 years. It's not a fungus, it's psoriasis.
Yeah.
So just all of that, that's what we're here for. We know all this, okay? We know everything and what everything means. And so that kind of check should be done once a year. Now, if you have other conditions and you're in treatment, so that'll vary based on the type of treatment that you're getting. And then the idea of those checks are to make sure that the treatment is working and there are no side effects. So your dermatologist is just kind of monitoring, making sure everything is ordered, everything's okay. Like an acne patient, for example, who's on Accutane will come every 3 months. A patient who's on a very specific medication for psoriasis will also come every 3 to 6 months, depending on what time, if they just started the treatment or they've been in this treatment for years.
Now, we've talked all about skin. Let's just talk lastly about internal. Okay. Because obviously you're advising patients as well as, what we should do internally to have a beautiful skin like yours. Right?
Yes. So everything actually comes from inside. So what we'll find, or the conversation that I find myself having with patients at least 4 to 5 times a day, is like patients that come in with skin tags, patients that come in with darkness behind their neck or their underarms. We have to advise them, and I do advise them. We're going to do a full metabolic screening. Whatever is not within normal range, I will refer you to the adequate subspecialist, and you need to take changes with your diet.
Definitely.
Okay? So is diet going to cure your skin? No. Is diet a major influential factor in your skin? Yes. Yeah. So your treatment is never just going to be like, well, just change your diet and your skin will get better, because that doesn't make any sense. But if your diet influences an insulin resistance, or is the cause of an insulin resistance, or is the cause of high levels of cholesterol inside your body systemically, it will be reflected in your skin. And I can give you all the treatments, and none of that is going to get better until you change your diet.
Yeah.
Okay?
It's all about lifestyle.
Everything is about lifestyle.
Definitely. Everything's about lifestyle. Well, Karishma, it's been such a pleasure talking to you. Is there anything else you'd like to tell our audience? Anything my audience can do for you?
No, but thank you so much for having me.
No,
and this is so much fun. I feel like we could just kind of talk about
keep talking and talking. Yeah, I told you in the beginning it's going to be a very, very easy chat, but very interesting. You have educated us a lot. You've told us in just a very short time a lot of points that you brought up that are very important. We need to see a dermatologist, which we don't. I don't. I mean, I never thought I needed to see a dermatologist. It's never said. You see a dentist, you see a doctor. Dermatologists were always the last thing on your mind, but I think it's important to go and see a dermatologist.
And the curious thing about that is your dermatologist will probably be the first one to tell you, you need to go get this checked because your skin is telling me something. So we just saw a patient, and we operated a keloid on her ear. Right. And a young patient, 29 years old, and she was just bleeding and bleeding and bleeding. I think you need to go get your blood pressure checked. And she went in, and yes, she's hypertensive. Other patients, diabetes, check. Cholesterol, check. Like, your dermatologist actually will be one of the first people to notice something is off. So yes, it is very important to go to your dermatologist.
Yes, I think that's like what you've said. I'm definitely going to come in for a checkup every year, because that's, it shows in your skin first. And we all know that. Our grandmothers used to say that. You got a bad skin because you don't eat well, or your tummy's upset, or whatever, right?
Yes, absolutely.
It's so true. So we thank you so much for being our guest today,
Thank you for having
and we're
me.
going to follow up with you in a few months and see how the new beautiful clinic is doing.
Thank you.
With your new laser removal.
And the
hydrodermabrasion
for the face.
And we'll follow up with you and see how it's doing. And I'm sure by the time we come next time, it's going to be expanded even more.
Oh, how exciting.
With more machines. I think we need that. And I would encourage my audience to see a dermatologist for any treatment. Because you know what? If your face gets damaged and it's not reversible, it'd be a very awful thing.
Yes,
it's not easy to live with,
absolutely.
and I'm sure you've seen that many times.
Yes, we do. We see a lot of complications.
Yeah. So I want to thank you. This is Rohini Kapoor, your host, and if you liked what you saw, please hit subscribe, like, and share. And if you have any questions, feel free to contact Dr. Karishma Daryanani at the Panama Clinic or on my website, stepbysteptalks.com. Until next time, have a super day.